Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about the policy of care of dialysis patients. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to all hospital services provided to dialysis patients. The purpose of this policy is 1. To provide optimal care to hemodialysis patients. Number 2. To identify the documentation required for the care team to work and to communicate effectively. Number 3. To identify patient monitoring requirements. Policy statement. Number 1. Policies and procedures guide the care of patients on dialysis. Number 2. All patients should be eligible and must have hospital file before presenting to RDU. Number 3. Complete patient's data must be available for proper identification, including name, medical record number, age, sex, nationality, and RDU number. Number 4. Patient presentation to RDU from another hospital area must be upon nephrologist order for indicated cases only. Number 5. All dialysis patients should have their monthly investigations done in the first week of every month. Number 6. Care plan of dialysis patients should be reviewed by the multidisciplinary team in monthly regular basis. Procedures. Admission criteria. Number 1. Patient presentation. Outpatients coming from home may present alone or with relative. Inpatient must present with the floor nurse, who will endorse to the hemodialysis nurse the latest vital signs, doctor's order, blood products or medication to be given during and after hemodialysis. ICU patients treated by continuous renal replacement therapy in ICU by nephrologist. Emergency patients coming from ER must be accompanied by ER nurse, who will endorse to the hemodialysis nurse a brief history of the case, vital signs, and doctor's orders. Referral patients from another hospital or another city must have an acceptance letter and appointment before coming to the hospital, which can be pre-arranged by formal referral faxes and acceptance reply. Number 2, diagnosis of end-stage renal disease requiring renal replacement therapy in the form of hemodialysis depends mainly on investigations in addition to the clinical picture. Glomerular filtration rate, abdominal ultrasound, and biochemistry. Number 3, the newly admitted patients to hemodialysis will have the following steps completed before starting dialysis: informed consent, history and physical examination, hemodialysis order, baseline laboratory investigations including CBC, biochemistry, and viral screen, and vascular access, temporary or permanent. Pre-dialysis assessment of patients. Pre-dialysis evaluation must be done before starting hemodialysis by the assigned nurse to the patient, who should refer the patient to charge doctor if there is any significant symptom or sign. This evaluation should include general condition and level of consciousness, asking the patient if he or she have any complaint, pain assessment if any, vital signs, assessment of risk of fall, and fluid status. Assessment of vascular access includes type and location of access, visual inspection, manual palpation, and first cannulation should be done by experienced hemodialysis nurse. Monitoring of patients during dialysis. Number 1, doctor's rounds. A. Assessment of clinical condition of the patient. B. Dealing effectively with any finding, including prescription of medications and referral to appropriate service. C. Change of default dialysis prescription and routine medications whenever necessary. D. Review nursing assessment for risk of fall and pain assessment to intervene accordingly. F. Review monthly investigations and take proper actions accordingly. The monthly investigations should include pre- and post-dialysis biochemistry, post-dialysis CBC, iron profile, renal bone disease indicators, and viral markers. G. Leads the multidisciplinary team in care plan of dialysis patients monthly with the staff nurse, dietitian, and social worker with active participation of the patient himself in the care plan. The care plan should include the following: Number 2, nursing monitoring during dialysis. A. General condition and level of consciousness. B. Asking the patient if he or she has any complaint. C. Vital signs. D. Observation of any complication. And E. Observation of the dialysis machine for pressures and alarms. Discharge criteria. Post-dialysis evaluation should be done by the assigned nurse, who will refer the patient to the charge doctor if there is any significant symptom or sign. This evaluation includes general condition and level of consciousness, asking the patient if he or she have any complaint, vital signs, fluid status, and observing any complications like bleeding or disequilibrium. Number two, discharging the patient. According to the doctor's order, to discharge the patient to home alone or with a relative, or to discharge the patient from RDU to another hospital area that must be accompanied by staff nurse and another endorsement. Number three, home advices. Patient should be reminded about his next appointment, and patient should be advised about home precautions if he doesn't know. For example, care of vascular access and home medications. Responsibilities. Number one, responsibilities of nephrology doctor. Supervising all nursing investigations to the dialysis patient. Clinical assessment of the dialysis patient. Ordering for admission, dialysis, and investigations. Designing default dialysis prescription and regular medications. Performing daily rounds on dialysis patients. Reviewing monthly investigations and intervene accordingly. Lead the multidisciplinary team in care plan of dialysis patients monthly and discharging the patient. 2. Responsibilities of dialysis nurse. Following nephrology doctor instructions. Pre-dialysis evaluation and referring any significant findings to the treating doctor. Execution of dialysis session and drug administration during and after dialysis. Patient monitoring during dialysis. Dialysis machine observation. Post-dialysis evaluation of the patient. Home advice to the dialysis patient. We have some important attachments to this policy. Hemodialysis consent form. Dialysis nursing assessment form every session. Nursing assessment during hemodialysis. Doctor's assessment form. and care plan of dialysis patients. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.